Good day, everyone, and welcome to Vax Facts and Frequently Asked Questions presented by the National Kidney Foundation of Michigan. My name is Barbara Garcia, and I will be your host for this month. Very excited to be here, and thank you so much to everyone. Welcome, everyone in the audience that took the time to join. Um, this month, we will be covering very important topics as every month. So, again, just a reminder that this is a virtual space where we hope that we can keep you informed on how to stay healthy, as well as keep you up to date with the latest information on COVID-19, on flu, as well as other respiratory viruses that might be circulating. Particularly this month, we will be discussing COVID-19, flu. We'll also talk a little bit about the CDC's Bridge Access Program. We'll have respiratory syncytial virus updates. And then we'll also talk about Medicaid and Michigan bridges. And then we'll end with sharing some tips on how to stay healthy during fall and winter seasons. So let's go ahead and jump right into our COVID-19 updates. So if you aren't familiar yet, the CDC, a couple months ago, once the public health emergency ended, developed a website where anybody can go in it and know a little bit more about what the hospitalizations due to COVID-19 in their counties are. And based on that, we're able to take the right precautions and the right steps, right, to prevent getting sick. So I highly encourage everybody, if you haven't already done so, to check out this website. You can also scan the QR code with your mobile device. And basically what this does, again, this would just help you know your COVID-19 hospitalization admission percentages in your community, in your county. And by knowing this, you'll be able to take precautions, right? It also the website will share what precautions you should take based on the level of hospitalizations, admissions. So again, highly invite everybody to check out this website. This is a really great way to stay informed, to know again what are what is COVID-19 doing in your community, right? And just making sure you take the appropriate steps to protect yourself, your family, and your loved ones, right? So again, just make sure when you get an opportunity, you can peek around the website. They frequently are updating the numbers per county. So again, any county in the United States, pretty much, right? So highly recommend. Okay, and next up, I would like to share some great news with all of you. Very great news. So, on October 3rd, the FDA approved a Novavax updated COVID-19 vaccine. So, as you know, last month the FDA approved a Pfizer and a Moderna updated COVID-19 vaccine. So now we're going to have a third option. So the third option is the Novavax updated COVID-19 vaccine. It is available at pharmacies nationwide. Again, this vaccine is different from the Moderna and the Pfizer, but at the end of the day, they're all safe and effective. Okay, so we're gonna get into more details so that you can be more well informed regarding the Novavax COVID-19 vaccine. But it's very exciting to hear these news. So as of now, the CDCs have recommendations for the Novavax COVID-19 vaccine. So anybody that is 12 years and older who have never been vaccinated against COVID-19 can receive 2 doses of Novavax updated COVID-19 vaccine. Now, for people who have received any previous type of COVID-19 vaccine, these people are eligible for 1 dose of the updated vaccine from Novavax, but it can also be 1 dose of Pfizer or Moderna. And then for people who are immunocompromised, these people might need additional doses. So it's always recommended that you check with your healthcare provider and ask these questions just to make sure that you're up to date, right, and you're following the right steps. So the way Novavax works is that this vaccine uses a coronavirus protein that basically will prompt an immune response against the COVID-19 virus. So Pfizer and Moderna, they use an mRNA technology. And basically what the mRNA technology does is that it teaches the cells how to prompt an immune response against COVID-19. So for those people that, might be hesitant about receiving a vaccine with mRNA technology, might prefer the Novavax COVID-19, the updated COVID-19 vaccine. So the Novavax vaccine uses the same technology as the flu shot. So it's always an option, if you don't feel comfortable receiving a Pfizer or a Moderna vaccine, that's made with mRNA technology. Well, there's always the updated Novavax COVID-19 vaccine. So this is great news. Again, if you have more questions, I invite you to ask these questions to your healthcare provider. They'll be able to tell you more in depth if you should get it or not. But again, Pfizer and Moderna, are still safe vaccines. So is Novavax, so we have 3 options. And if you need more information, if you're not sure where to go to find information regarding Novavax or Pfizer or Moderna, you can always visit vaccines.gov. You'll be able to find where to go to find a vaccine. Also, if you have private insurance, Medicare or Medicaid, for the most part, your updated vaccines should be free upfront. As always, I recommend that you check that with your healthcare provider prior to your appointment to receive a vaccine. And also for people that might be under and uninsured, you can also receive an updated COVID-19 vaccine for free through the CDC's Bridge Access Program. And we'll talk about this a little bit more in our next slides. But the great news is that you can get a free COVID-19 vaccine. So no need to worry about that. And now some people have asked, well, what do I do if I recently had COVID, but I want to stay up to date with my COVID-19 vaccine? So experts recommend that you wait 3 months at least before you head out to your healthcare provider to receive your updated COVID-19 vaccine. And why? This is because, reinfection tends to be less likely during that time when you just had COVID-19. However, there is certain factors that could be a reason to immediately, go get vaccinated sooner rather than later. So this includes, if you have personal risk of severe disease, if there's risk of disease in a loved one or with a close contact, right? It's also going to depend on the local COVID-19 hospitalization admission levels, which is what I was talking about earlier, that it's really important to check out, that CDC data website so you can stay informed with what are the hospitalizations, right? And how contagious is the virus, right? And then, so all these factors are going to vary, right? So at the end of the day, if you're not certain, you caught COVID-19, but you want to receive your updated COVID-19 vaccine and you're unsure, we recommend that you go and talk to your healthcare provider. Okay, that's always the best option. And then here on the screen, you'll see to find, again, a COVID-19 vaccine, you can go to vaccines.gov. You can text your zip code to this number here, 438829, or you can also call this number here, 1-800-232-0233. So again, don't delay. And if you're not sure, it's always best to reach to your healthcare provider. And more great news coming your way. So you can get 4 free at-home COVID-19 tests, and these are provided by the government. So you can go on the website covidtest.gov, or you can also scan this QR code here with your mobile device. And basically, this website will take you to the United States Postal Service, and all you have to do is type in a name, an address, and then you should receive in the mail, the postal mail, a package with 4 at-home COVID-19 tests. And honestly, these are really great. Why? Because it's one of our best tools to prevent the spread of the virus, right? And this is alongside getting vaccinated. So again, COVID-19 vaccines, yes, they'll effectively prevent infection, right? Hospitalizations, including death, right? However, no vaccine prevents 100% of infections, right? So as the virus continues to evolve, it's important that we take the right precautions. And so this can be one of the proactive steps that you can take, is taking it at-home self-testing when you might be concerned that you might have contracted COVID-19. So again, these are free. We don't know for how long, right? So take advantage of it. Again, you can just go on covidtest.gov, or you can also scan this QR code here, and you should be able to receive 4 free at-home COVID-19 tests. Okay. Also, more great news. You can also visit this next website or scan the QR code. So you can find a list of participating libraries here in Michigan that are offering up to 5 free at-home test kits as well, for each household. And this is, again, while supplies last. Libraries will tend to get, every month they'll get like a quantity of supplies, right? But again, we don't know how long these kits are going to last, right? Depending on how much demand there is for them. So don't delay. I invite you to check out this link or QR code, and make sure that you pick up your at-home test kits that are free. And what's better than free, right? And not only that too, but with fall and winter season, I mean, really any season, we might be picking up viruses. We might not be sure if it's COVID or if it's a cold or a flu. So what better way, right, than to get tested at home, to be proactive and make sure that we're not going out there, right, in the community and getting others sick. So again, I highly invite you to check out these QR codes or these websites, so you can receive these free at-home test kits. These tests are usually not cheap. If you go, to a pharmacy or to a grocery, they're pretty pricey. So highly recommend that you take advantage of this opportunity. And so now we're going to talk a little bit more about the CDC's Bridge Access Program. So the CDC Bridge Access Program, it's a great program. Basically, this program is offering free vaccines for COVID-19. So basically, they're available at no cost to you. So specifically, for people who don't have health insurance, or people whose insurance might not cover all of the COVID-19 vaccine costs, this program is available for everybody, to be able to receive a free COVID-19 vaccine. So if you have questions on where you can find this, again, you can see here the website, which is vaccines.gov, or you can also scan the QR code that you're seeing on the screen. So for the most part, health insurance will cover, COVID-19 vaccines, or if you have like a Medicare or Medicaid plan. However, in the United States, there's anywhere from 25 to 30 million adults without health insurance. right? Um, so of course we need to be able to also help those individuals, right? So this is a great program. I invite you to check it out. If you need a free COVID-19 vaccine, or if you know of somebody that could benefit from this program. However, this program is expected to end by December 31st of 2024. So I encourage everyone to take advantage of this program now. So now we're gonna jump into flu season. So some flu information. So, as many of you might know, flu can be potentially serious, right? And sometimes even deadly, right? And this is like the flu does not respect your age, your health status, right? So it can be dangerous for everyone, but specifically even more so for those with chronic conditions, for infants, for pregnant women, right? So it's very important that every year you get your annual flu shot, right? It's very important if you want to stay healthy, especially now in the fall and winter where you might not know if it's flu, if it's a cold, if it's flu, if it's the RSV virus, or if it's COVID-19, right? People do get hospitalized because of the flu. So getting vaccinated for the flu, you're protecting yourself, but you're also protecting those that come into contact with you, your family members, your friends, your coworkers, right? And then, of course, community members. So it's very important that every year we receive our flu shot. And again, if you don't know where to go to find a flu shot, you can scan this QR code, or you can go to vaccines.gov. Everybody 6 months of age and older needs a yearly flu vaccine. Again, influenza or flu is a very contagious viral infection, right? And sometimes you don't know. Sometimes it can cause mild illnesses, but sometimes it can become severe, right? And then this will result in complications that can lead to hospitalization or even death. So the best way to prevent influenza is to get your annual flu shot. Again, you can visit vaccines.gov or scan this QR code. It's never too late to get your vaccine for the flu. So if you haven't already done so, I highly encourage you to visit your healthcare provider, or to visit vaccines.gov, or scan the QR code. Okay, so by being vaccinated, you're protecting yourself, you're protecting your loved ones, right? You're protecting your community members. So flu is especially very serious for people who are pregnant, people who are over the age of 65 or 65 and up, sorry, and also for people with chronic conditions. So this can be, diabetes, heart disease, asthma, any type of a chronic condition. So again, I invite you to if you haven't already done so, get your flu shot. If you have grandparents that have not received their vaccine, I recommend that you share with them the importance of getting vaccinated, especially at that age. If you know of somebody that is currently pregnant, or if you yourself are pregnant, highly recommend that you get your flu shot. If you have doubts, if you have questions, if burning questions that you might have, or uncertainty or hesitation, I invite you to address all these questions or feelings to your healthcare provider. Okay. And something else to know, sometimes people might not know if they have a cold, if they have a flu, right? So influenza can cause, again, anywhere from mild to severe illnesses, but some of the most common symptoms that you will see with the flu include fever, or maybe having chills. You'll have a cough, a sore throat, the runny or stuffy nose where you're constantly running for some tissue. You might feel muscle or body aches, headaches, fatigue. And also some people may have vomiting and diarrhea. So although this symptom is more common in children rather than adults. So these are all symptoms that you might experience if you were to get sick with the flu. So what should you do if you get sick with the flu, if you end up getting, the flu? So most people with flu, after a few days, they'll recover, right? However, sometimes there is situations where you might need medical care or antiviral drugs. So we recommend that if you get sick with the flu, the best thing you can do is contact your healthcare provider, right? And they will be able to guide you and give you the best information and the best care that you'll need. And maybe that can be, taking antivirals, right? So don't delay if you're unsure, if you're very sick, you're very worried. Always contact your healthcare provider, whether that's a doctor, a physician assistant, a nurse, wherever it is that you go. Or if you don't have a healthcare provider, you can also call a community health clinic, right? And just try to get to see a provider. Okay, so it's really important that when you're not feeling well, that you make sure to check those symptoms, right? Just to make sure that it's not flu, and that if it is, that you're taking the appropriate steps, right? And then again, the best way to prevent flu or to fight it, right, is to get vaccinated, right? So again, flu is very serious for children under 5, especially children under 2 years old, for pregnant people, for people who are over the age of 65, and then for people who have any type of chronic disease. So this is again like asthma, diabetes, heart disease. So the best thing you can do is vaccinate, right? And then the second best thing you can do is test. So like I was mentioning earlier, don't ignore those symptoms, right? If you think you might have the flu, call your healthcare provider, ask to get tested for flu, right? Again, flu symptoms might look like many other illnesses, right? So testing will be the only way to know for certain that you in fact do have the flu, okay? So again, knowing which virus is making you sick will allow, yourself to stay safe, but also keep those around you safe as well, right? And then number 3, if you do test positive for flu, right, most likely your healthcare provider will give you antivirals. So it's very important that you take those antivirals that are prescribed, right? So that you can hopefully feel better quickly, right? And also by treating the flu, you're decreasing the risk of flu hospitalizations and also death, okay? So these are 3 simple steps, right, that we can take to fight the flu. And then again, yes, people are like, well, I've received the flu vaccine, but somehow I still ended up sick. Like, yes. So again, people who get vaccinated may still get sick with flu. However, they'll be less likely to have serious, symptoms, illnesses, right? And hopefully, most likely will not be hospitalized, okay? So just getting the vaccine is always the best choice, okay? And so now that we've talked about COVID-19, and then we've also talked about the flu, we are going to talk about RSV, which is the respiratory syncytial virus, that is also trending currently here in the United States. So what is this virus? So this is a common respiratory virus, right, that usually will also cause mild cold-like symptoms. So that's another reason why you want to get vaccinated for flu every year, right? Because we don't want to mistake the RSV for a cold. Most people recover in a week or 2, but RSV can also be very serious. Generally, infants and older adults, are more likely to develop severe RSV and might need hospitalization. So again, vaccines are available to protect older adults from severe RSV. So also, if you know of anybody with young, infants, or if you have an older adult in your family, I invite you to chat with them about getting a vaccine for RSV. prevention options are available, right? And this is to protect infants, pregnant women, and also older people. So people that might be a little bit over 60 years old. So the CDC recommends that, again, adults that are 60 years of age and older receive a single dose of RSV vaccine. And then they also recommend that all infants younger than 8 months born during or entering their first RSV session or CSEM, that they receive one dose. And then they recommend one dose for infants and children that are between 8 and 19 months old, who are at increased risk for severe RSV disease and who might be entering their second RSV season. And then they also recommend one dose of maternal RSV vaccine during weeks 32 through 36 of pregnancy. So again, if you know of anybody who's currently pregnant and is getting close to weeks 32 through 36, I invite you to share this information with them. If you know of adults who are 60 years and older, I also invite you to share this information. As well as if you have an infant or you know of anybody with infants that are younger than 8 months, or also infants and children between 8 and 19 months old, they all qualify for an RSV vaccine. And again, if you have questions, I recommend that you call your healthcare provider and you have these conversations, right, with your medical team. So next up, we are gonna jump into a different topic. So now we're gonna talk a little bit about Medicaid renewals and what that is. So we've been talking about this for quite a little while. However, we haven't brought it up in the past 2 months. So this is just a friendly reminder of Medicaid renewals. And so again, so when the start of COVID-19, when there was a public health emergency, the Medicaid renewal process stopped, right? So you didn't have to do redetermination to see if you qualified during that time for these benefits. However, after the public health emergency ended, the renewal process restarted. So if you have Medicaid, Michigan Child, or Healthy Michigan Plan, you might need to go through the renewal process. So here are 3 steps that you can follow. And so basically, it's really important that you do this and that you follow these steps in order to find out if you're still eligible for free or low-cost Medicaid coverage. So number 1 is making sure that you update your address, your phone number, and your email address at this website here provided. And in the next slide, I will share the QR code as well and a phone number as well. So whatever is the easiest, whether it's calling the phone number or going to this website or scanning the QR code, that will also take you to that website. So number 2, reporting any changes to your household. So if there's more people that are living with you now, or your income as well, if that has changed. And then step number 3 is making sure that you check your postal mail, since you might be getting some mail from them if you haven't already, right? And it's going to ask you to fill out a renewal form. So these are very important steps, and I'm sure it can be confusing or maybe even difficult to understand. But again, you can visit this website. Also, let's go to the next one. Also, the Michigan Bridges website can help you apply for benefits. You can find resources. You can go and look at your case and see what the status is. So you can access Michigan Bridges anytime on this website that you see here on the screen, or you can scan the QR code. It'll connect you to the website, and you can apply for many different types of benefits that include healthcare coverage, food assistance program, if you need cash assistance, child development, and also state emergency relief services, such as maybe, paying for utilities, housing services, etc. So I recommend that you check this website, scan the QR code. But most importantly, if there's something that you don't understand, you have questions about how to fill out the forms, where to mail them, where to find these services through Michigan Bridges, I invite you to call this line that you see here. It's toll free. Or you can also go to the website and get some more information on the 2023 benefit changes that are taking place. This is a great number. They operate during business hours. And they should be able to address all these questions. It's normal to have questions and not know everything. So please feel free and comfortable, to call this number or visit the website if there's something you don't understand. Okay, so don't let that stop you from receiving those benefits. Okay, so make sure you call or check out the website. Okay, and lastly, last but not least, so just a friendly reminder of remembering to stay as healthy as possible, during fall and winter seasons. It gets cold outside. Um, we might not be getting a lot of exercise outdoors, right? But just remembering to stay healthy. And so things that you can do, right, to remain healthy, not just you, but also your family members. It starts as simple as, being proactive and getting your COVID-19 and flu shots, right? Remembering to use that website through the CDC so you can track your COVID-19 levels in your community, in your county, right? Remembering to wash hands, especially when you're at airports, train, public transportation, when you're in and out of buildings, right? So very important to wash your hands, and also to teach that to your children, right? To wash their hands. Very important to try to move daily, right? And that means that maybe if you have a job from home, right? Well, maybe that means every 30 minutes getting up and stretching, right? Or marching in place, or going for a walk around your house, right? So while the weather's still nice out, just getting some exercise. A lot of these activities can be free, like bike riding if you have a bike, jogging, walking. You can even do a yoga class or meditation from the comfort of home. All you need is access to internet, and then maybe like a monitor or a smartphone where you can pull up a YouTube video, right? So these are all just examples of things you can do to stay healthy during the fall and winter. It's also very important that you remember to eat healthy. And what does that mean? Well, that means remembering, to incorporate fruits and vegetables, right? And also getting your health screenings, right? So when you have that 6-month appointment, not canceling, remembering to go and get your health screenings, right? You want to be proactive and keep up with that. It's very important that you try and get enough sleep. I know that can be hard for many of us, right? But it's very important that you take care of yourself, because if you're not taking care of yourself, you won't be able to take care of those around you, right? So like your family, and all those around you. So it's very important that you make the time to stay healthy, right? And also you can make it fun, and you can do it as a family, right? And just come up with fun activities that you can do, right? Or you can come up with challenges in the family too and see who can get the most steps in a day, right? Also, dressing appropriately for the weather, right? So that means that if it's cold, making sure that you're wearing your coat, your hat, your gloves, your scarf, right? So these are just some tips that you can incorporate in your daily lives during, especially the months of fall and winter. And then again, just remembering to be up to date with your vaccines, right? For COVID-19, for flu. Again, so everything can be found here in this presentation. If you need to go back to it, or if you have any questions or comments, you can also feel free to send us an email at reach@nkfm.org, or you can visit our website, nkfm.org. So this presentation, you can find it in our website. You can also find it in all other spots where we broadcast, which is our YouTube page, as well as our Facebook page. And those spaces, or excuse me, in those platforms, you can find all these presentations that we've been doing every month. If you have questions, you can always go back to one of these presentations to find this information that we've shared. But this information will be here permanent, so you can look back. And we hope to see you perhaps in a couple months, and we'll come back and we'll give you new updates that we might come across. And in the meantime, I hope that everybody takes well care of themselves, is up to date with their vaccines. And again, I invite you to share this information with your loved ones, friends, community members. And these presentations, videos will be saved in our channels, again, which is our YouTube channel, our website, and our Facebook. Thank you so much, and have a great rest of your day. Bye-bye.